be. Well, I think you got most of the sound you want. I am very excited about this because I think it's going to respond to a lot of the feelings that taxpayers have, you know, and when they hear that there will be a program that can result in people getting work and being able to be independent, I think they're going to love that, and it's what they want, it's what they ask for, and so I'm excited. I think we have the right guy. I think Doug Lumpkin will do a great job. He knows how to communicate. He's been in those positions. You know, I think we're off and running. It'll be a committee effort to figure all this out, and we'll work with people where there has been success, and you know, we'll see how much we can achieve, and it's going to be, I'm sure, an ongoing process, but it's really worth doing.
So I wanted to ask you a little bit about welfare reform, because I guess I've been here a while, so I remember when we were doing that. How is this different, or how is it much the same?
I think that the framework was established, for example, that you know, welfare is no longer an entitlement. It's not going to exist, you know, interminatively, and then there were some rules put in terms of training and things like that. But it's time to revisit it because it's bulky. It is you know, time has come to innovate it and respond to it, the problem, more effectively. So let me just suggest that being able to get everybody to work together, being able to get the welfare, the health care, the education, the job training, get all those people in a room and making the operation seamless is, I think, going to get to the nub of the problem. I mean, we had a welfare system for, I don't know, from the 30s to the 90s, 60 years, and we're just really revisiting it all. And it's been a challenge for me. It's been a source of frustration that I sometimes see these fragmented systems. Now, when we did Medicaid, you know, this was not something that just, you know, we thought up last week. I've been thinking about this for a long time. I wanted to pull everything together. What are these one-stops? How do these WIB board works? How does the Jobs and Family Services work? How does it work in one county? How does it work in another? Are they using Ohio Means Jobs? Are they training people for jobs that exist? We have so many training programs. All these things together, I said we got to pull it all together. And actually probably came up with this idea maybe even as long as a year ago, and I said, I'm tired of thinking about it, let's do something, and that's how we created the office. So I think what you're going to see with this is you're going to see a collaboration that we haven't seen. There have been too many silos in the world of delivering services. Doug, is that a good way to put it?
Yes, it is.
Why don't you come on up here for a second? I think, you know, when you silo this, when you have the workforce boards that are separate from the welfare operation, when the welfare operation is spending so much of its time trying to determine qualifications without treating a person holistically because of the federal rules, when you don't take the in-demand jobs that are out there and take them to the people who need to get them, when the training dollars don't match the kind of things that, the kind of skills that people need to have, then all you have is a structure that's divided up in many different rooms, and now what we're doing is knocking down all the walls and trying to get everybody in the same area for the same purpose. Say something about this, Doug.
So, consistent with that, as I mentioned earlier, it's really to take all of this and weave a tapestry that is holistic for the person, and to find a way to help put them on that path, and to take all of those things that the governor has said, try to find ways to break that down, collaborate, think about it differently, think about it without the turf, think about it in the context of what policy is. He mentioned the federal policy and some of its issues. There are also some state policy kinds of things as well. Think about it in the terms of practices and how we practice that, and try to put all of that together in a different way. All right? The world has moved. The world has moved in the way of what we can do policy-wise. The world has moved in what we can do technology-wise. The world has moved in any different ways that society now looks at things. We need to take that framework, retool it in a way that is holistic and responsive to the person and the family.
Think of it this way. We had a new engine put in the car in the 90s. The problem was the parts of the engine didn't work together so the car would move. So now what we're doing is we're making sure that all the parts work together so that you can drive your car. And there's a lot of theory out there. You know, job training programs. I mean, how many times is Congress going to pass a job training reform program that has no impact? I mean, Doug will tell you that there are training programs that are in our state now that are just completely ineffective. They're not trained. People are meeting the requirement of being trained so they can keep their benefits, but they're actually not acquiring any skill that allows them to get a job. So I think at the state level now, we are in a position to make sure that the pieces work together. You know, that with a welfare department, I'll give you one good example. We went from caseworkers to checkers. Now we have technology that allows us to do the proper checking to prevent fraud, but now we can turn the checkers into caseworkers. You know, now we can deal with people holistically instead of, if somebody walks into a welfare agency and we give them food stamps and say, see them next month, we haven't solved our problem. It's when somebody walks in and says, look, I'm hungry, my kids are hungry, and that person says, oh, okay, well, here's the help, but what can we do to help you? Think of it this way. We're trying to move from an emergency room to a full hospital, so we can treat all the things that are bothering you. And what Doug's he's going to run into is people are going to say, no, I don't want to work together, I don't want to do this, I've done it the old way. Doug, tell them what you're going to run into, because there'll be obstacles.
All of those kinds of things that the governor mentions. I talked about turf, I talked about practices. I would deem eligibility, as he mentions. So you're in the emergency room, and I mentioned it in my comments. We're going to routinize that, and using technology will gain all of the efficiencies. But I need to now reinvest that into what the governor's talking about, which is turning that part into some of the case management pieces, some of which we lost during the recession, some of which we lose given turf battles, some of which we lose doing programs not talking to other programs, even though there is a holistic piece to it. We know, as I mentioned out there, how education plays into this and what the opportunities there are, but how do we match that, all right, and have parents understand that, so that not only are we moving them forward, but we're moving their children forward. And so all of those kinds of things.
There probably aren't enough places that when a person walks in who's looking for a job, you have the business community saying, hello, we need workers. That somebody says, okay, well, we'll train this worker. Oh, for that job that exists? Oh, fantastic. And by the way, your benefits, we're not going to take them away. We're going to let you keep your benefits and work your way out of this situation. So you have business, you have training that's real, you have compassion, but you have discipline and accountability. All that should work. Those pieces have largely never been brought together before. Even our workforce investment boards. You know, these are people supposed to advise people about the kind of jobs you need. Do you know that the workforce investment boards are like 41 counties? That's the way the Fed set up. 41 counties. How can you determine what you need in a particular area when the board represents 41 counties? And how many of the business people on these boards take this seriously? How many of the bureaucrats take it seriously? Some places they do. Other places they don't. This is going to be a big challenge, but it's great. It's worth doing.
Governor,